Next up was a talk by me on informed consent, some quite dry law. Until quite recently, Nadine got in contact with me to talk about potentially coming to the event, which was terrific. She's agreed to just come and talk to us about the landmark case of Montgomery. She was the claimant in that case and has fought long and hard for her brilliant decision in the Supreme Court, which has affected patients' rights and women's rights in maternal care. She's an inspiring young woman. She has Sam, who was born in 1999 with cerebral palsy following the shoulder dystocia Montgomery case. And she has since done not only was she a geneticist, but now she's doing a law degree. So utterly inspiring. What I'm going to do is, after Nadine's finished, I'm going to just mop up some informed consent update law, but I thought everybody would rather listen to her than me. So welcome, Nadine.
Well, thank you very much, Suzanne. I really wanted to attend this meeting when I heard there was women's rights, and I thought someone like myself who's fought for 15 years, these are my people. I was really keen to come. So when Suzanne, when she said, would I want to speak, and obviously this is fantastic. So I'll talk from, we've heard from loads of wonderful professionals. So maybe a patient's perspective, just to bring it back down to, how it feels from a patient. So my journey in wishing to bring about improvements in informed consent to patients began 20 years ago, when my son Sam was born with cerebral palsy following a very traumatic delivery. And I want to emphasise that it's not about blame. It wasn't about blaming a particular doctor. This was about something bigger. This was about me wanting to understand what had happened to me, why it happened to me, and wanting to make sure with every fibre of my being that this didn't happen to another woman. I think there are times in life where you really have to stand up for what you believe in, even if you're standing alone. And for me, this was one of those times. But I wasn't alone. I had the support of my family, who were all medical. My father was a hospital consultant, my mother a GP, and my sister then was a junior doctor in anaesthetics. And it was actually her speciality that led on to me initiating the process and leading to change. So the background to the case is I was type 1 diabetic. I have been since I was a small child. And I grew up attending the same diabetic clinic who, I think 1 in 4 people are diabetic. There must be someone else in the room that is. It become like your family. You attend a clinic and you see them every week or every second week, and they look after every aspect of your life, your education, your hormones, everything. And so I knew them very well. So when I was much older, 24, married, expecting my first child, I was really happy that they told me they were going to continue my care with an obstetric clinic. So it was a novel concept then, a joint diabetic obstetric clinic. And it was like a one-stop shop, all singing, all dancing. They took care of everything for you. And that made me really confident and happy that I was going to be well looked after. In fact, I felt, a little bit smug maybe, 2 consultants looking after me, and all the midwives and all the other staff that went with it. What could go wrong with my pregnancy? So as the pregnancy continued, towards the 2nd trimester, I was told that they would do something called serial fortnightly ultrasounds, and they would look at the estimated fetal weight. And one of the things that I became aware of is that they were really concentrating on the size of the baby. And from about 32 weeks onwards, I could see that the baby was large and he was gaining weight rapidly, and he reached the 95th centile. I could see them plotting a chart. And this was despite my meticulous diabetic control. So I raised my concerns during that period more than once to my consultant obstetrician, particularly about my ability to deliver a baby of that size, given that I'm only 5 foot tall. And I was always met with reassurances, you don't need to worry, we're taking good care of you, we're looking at these, all these issues, and please don't worry. And I felt reassured with that. So I was brought in for induction at 38 weeks. And I went into labour really quickly after administration of a hormone gel, and therefore went through the whole labour, which was augmented with Syntocin, and I had an epidural for pain relief. So the following evening, I won't bore you with all the details of the whole labour, but the following evening I was told that they would take me to theatre for something called a trial of forceps. And again, I was unsure what was going to happen, what that meant. So when the junior doctor came to consent me, he brought me a form and he said that we're going to try something called trial of forceps. So again, I asked my questions, what does that mean? You know, what should I expect? And I was told, do not worry, we're going to go to theatre and we'll be able to assess you better there. We'll have a look and we'll be able to see whether we can attempt this. And if we can't, don't worry, we'll go straight for caesarean section. So again, that was, you know, adequate. I mean, I'm a patient, not a doctor, I didn't know. And so I signed the form and off I went to theatre. But I still had no real understanding of the procedure or any complications that could arise. So in theatre, after my epidural was topped up, they attempted to deliver my baby with forceps. And I was completely unaware of any of the complications unfolding. I was like flat on my back. I couldn't see anything. And what seemed like a long time of pulling and maybe just silence. You hear of lots of women telling their birth stories with, oh, alarms are going off and people are rushing. It wasn't like that at all. It was just eerie silence. So I knew something was wrong. And then the anaesthetist very calmly told me, we're going to put you to sleep. So at that point, I knew something was seriously wrong. I didn't know if it was me, it was the baby. So without protesting, I went to sleep. And I woke up to the tearful faces of my family. I knew that I had a baby boy, but he was very unwell, and he was in SCBU. And also the thing that I remember from waking up was the amount of pain I was in, and the just weakness, just as though I'd been in some terrible accident I can't explain. I think there's a picture of, is it the down button? That one. This is the picture that I was too unwell to go and see him, and this is the picture that the nurses had brought to me. And the nurses were wonderful. They updated me every hour. They told me everything that was going on, albeit I was too ill to maybe understand or comprehend what had happened. And it was horrible being given that picture. That's actually the only picture I can show you. The other picture, when he's not got the hat on, you can see the trauma to his body. It's horrible. So it was feelings of both joy and just utter shock, extreme sadness, seeing him like that. And it was only really in the coming days that I learned what happened. And what I found out was during Sam's birth, his head was delivered using forceps, but his shoulders had become stuck for 12 minutes, and it was likely for that 12 minutes that he had no oxygen at all. And I later found out that's something called shoulder dystocia. Several last resort measures were attempted to deliver him, such as breaking his clavicles in order to fold his shoulders to pull him out, which was unsuccessful. An attempt was made to push his head back in, the Zavanelli manoeuvre, that was unsuccessful. And lastly, an attempt to break my pelvic bone, is that right? Pelvic cartilage. 2 attempts were made to do that, both unsuccessful. And the consultant explains that he was maybe born because it maybe created a bit of leeway, although it didn't sever the bone or the cartilage completely, maybe just opened up a little bit. And with a final surge of adrenaline, she pulled so hard in his left arm to try and release him, and he was born. He was born stillborn, obviously, after 12 minutes, and he required CPR and adrenaline to restore his heartbeat. So he spent a long time in special care baby unit. He initially had his lungs ventilated. He suffered with seizures due to hypoxic encephalopathy, and he had trauma to his head, neck, face with subdural hematomas. He was diagnosed almost immediately with the left Erb's palsy because he didn't move that side of his body at all, which was expected. And at 3 months of age, he was diagnosed with cerebral palsy. Obviously, I was in a poor way as well, both physically and mentally. But we both survived, and I thank God we both survived. But I didn't have a choice to, without belittling the injuries. I was listening to your stage 3, I don't know if there's a stage 5 or a stage 6. I don't know what stage I was in a mess. But I didn't have time to feel sorry for myself or be a victim. I'd now had a baby that needed me. And I just had to get up and go on with it. And of course, everything got infected, being diabetic and, all the complications that arose from that as well. So despite a basic explanation of events by the consultant, No answers had been given as to why this had happened, or whether it could have been predicted, or was it preventable. And it was my sister, through her training in anaesthetics, which included that doctors had a duty to fully consent patients, discuss options, and inform them of significant risks, that supported me towards finding answers about why this hadn't happened in my situation. She helped me research what the risks of shoulder dystocia in my situation might be. And after looking through GMC guidelines, obstetric college guidelines, as well as many other scientific papers, it became clear that my care with regards to explanation of risks, options of delivery, and informed consent had been well below standard. Through our research, we found out that there had been a high risk of shoulder dystocia with the risk factor of diabetes alone. It's stated it's around 9 to 10%. And then on top of that, you add in further risk factors such as a long labour, a large baby, instrumental delivery, and use of Syntocin. When I found all this out, I was dismayed, upset, angry that this had not been discussed with me despite my requests antenatally. And I felt that I hadn't been given the information that I was entitled to, nor been allowed to be a partner in decision making with regards to my care and my delivery of my child. And it's hard to understand a world, we can live in when someone makes a decision for someone else, but that someone else is the one that has to live with the consequences. So 20 years on, I'm still living with the consequences, and indeed Sam is, of a decision somebody else made or what they thought was best for us without involving us in the decision. So obviously, I wanted to make sure this didn't happen again. I composed an initial complaint letter to the trust, and I asked, amongst other things, why I had been informed of the risks to me or the options for delivery, including a caesarean section. And we were met with a standard, reply. Yes, we've looked into this and we've done our own investigation and we're satisfied that everything was adequate, And it always makes me wonder when trusts do that. It's a bit like marking your own exam paper, isn't it? We've looked into that, and yes, it's okay. We think it's okay. So there's your disabled child, on you go with your life. We're sorry about that. And so this upset me even more. And it appeared as though no one cared or even recognised that there was a deficiency in my care. And my concern was, if nobody recognised that, then no positive changes could be made from this tragedy. And if no positive changes were going to be made, then surely it would follow that this would happen again. So it became my goal to ensure that others did not go through what I went through, and the right discussions should be taking place regarding options and risks between doctors and patients, making their decisions together. So Sam, growing up, this is him now. He's at university now studying software engineering. He's nothing short of a medical miracle. We were told when he was diagnosed he would likely not walk or talk. He was initially fed by a tube. He lost his sucking reflex. Everything. The first 2 years of my life are a complete blur. I don't really remember much about it. We all took turns. My mum, as a GP, retired early so she could help me with him. And everyone pitched in, and we did a lot of physiotherapy, occupational therapy, speech therapy, hydrotherapy, you name it, we did it. All just to help him reach his full potential, whatever that may have been. And he's super clever, and I think that's harder for him because he becomes so frustrated when he can't do things that he can't run. He can walk with calipers, and he's got a kind of abnormal gait. He drags kind of foot behind. He's limited use of the left arm, which was expected. But we're very proud of all the obstacles that he's overcome. But I just feel so very sad because it didn't need to happen. It was so preventable. So what was the point? Then I asked myself, what was the point of me having meticulous diabetic control? I did my part. What was the point of serial fortnightly ultrasounds if no one was going to pay attention to them? And what was the point of this fancy diabetic obstetric clinic? I was there to prevent these things surely happening. And it upset the family structure too. I used to get upset with my mother, who was a GP, and I'd say, why didn't you? You're a doctor. You must have known that there's something called shoulder dystocia. Why didn't you tell me about this? And she tells me she's originally from Pakistan, and she tells me when she worked there, she told me a story of a man and a woman arriving to a hospital on horseback in a cart, and the woman had been in labour for days, and the baby sadly had passed away, and the mother was almost dead, and the father was pleading, please, help my wife, save my wife. And this is what had happened. It was shoulder dystocia, and the baby had been stuck for more than 24 hours. And my mum told me, this is what happens in the third world. This doesn't happen in the UK. This doesn't happen with all ultrasounds and all the fancy equipment and all the care that we should be given. So anyway. So going on to court, obviously I wasn't happy with the answer that I got from the NHS. And we have a different system in Scotland. We have the Court of Session there. And we start at the outer house where we bring our case. And then we appeal to the inner house. And I was unsuccessful on both times. They upheld the decisions in both Sidaway and Bolam that doctors should be assessed by their peers as to which risks should be disclosed to a patient. And although they accepted the 9 to 10% risk that diabetics could end up with shoulder dystocia, they focused more on the 0.1% risk of grave harm that would lead from that. But my argument's always been, the problem with shoulder dystocia is you don't know, out of all the people sitting here who might have shoulder dystocia, which is the one that's going to be the difficult one to this one might be really easy, a simple manoeuvre, and out the baby comes. This one, you don't know until you're in that situation how difficult it's going to be. So I wasn't giving up. So in 2014, I took my case to the Supreme Court. And this was the first time I really felt that someone was listening to me, that someone was interested. And they assembled a bench of 7 judges, and that gave me an indication that how seriously they were taking this matter. They only really do that when they're looking at changing the law or considering something serious. And also, unbeknown to me, the GMC appeared, and they spoke at the appeal, intervening on my behalf, and they highlighted the good medical practice guidelines from the era of Sam's birth and emphasised the need for doctors and patients to be making decisions together. So a year later, in 2015, after 15 years of fighting, all 7 judges unanimously agreed and held in my favour. And the ethical guidance with respect to informed consent that was already essential for doctors was now passed into law. And Lord Reid, one of the Scottish judges, stated, "The doctor is therefore under a duty to take reasonable care to ensure that a patient is aware of any material risks involved in any recommended treatment and of any reasonable alternative." And also the Supreme Court added that with the advent of the Human Rights Act, patients are to be viewed as persons holding rights now, not just passive recipients of the care of the medical professionals. And times have changed with support groups and the internet. But really for me, the judgment that held close to my heart was what Lady Hale said, and her words were, she so eloquently stated what I couldn't put into words throughout the whole case. And she said that whatever she had in mind, talking about the doctor, this does not look like a purely medical judgment. It looks like a judgment that vaginal delivery is in some way morally preferable to caesarean section, so much so that it justifies depriving the pregnant woman of the information needed to make a free choice. And I think that's how I felt throughout the whole, even now that's how I feel. I feel if you want to have a caesarean section, then good for you. If you want to go to hospital and have all the drugs and the gas in the air and the pethidine and everything, that fantastic. If you want to come down here and give birth on stage, well, it's not my thing, but good for you. All that should matter is that you know your options, you know the risks of every option, and you make a decision together with your doctor. So obviously, despite the unfortunate events that we went through, I still have a lot of love for the NHS. It's an amazing institution with doctors delivering excellent and high quality care around the clock. And it is so heartening to see so many great initiatives now going on around the UK, emphasising the importance of understanding what matters to patients and involving them as partners in the decision affecting their lives. From the I Decide consent tool initiative to a realistic medicine in Scotland and choosing wisely, it really does seem that the paternalistic medicine of the past is truly becoming a thing of the past. And if I can have helped in just a little bit of that, well, my work here is done. So Suzanne is going to give you an update on consent, where post-Montgomery, what's been happening since. So thank you.
Oh, great, I've got to follow that. Just one more quote from Lady Hale, because she was, really important in that judgment. And what she said was, pregnant women should be offered evidence-based information to support and enable them to make informed decisions about their care and treatment. Gone are the days when it was thought that on becoming pregnant, a woman lost not only her capacity, but also her right to act as a generally autonomous human being. And I think we all feel that in this room today. But thank you very much, Nadine. Brilliant and brave talk, which has spellbound us, frankly. So we've had a landmark decision that's changed patients' consent, the way it's done, and also a lot to do with maternal care as well, and how women are treated in terms of pregnancy. So what I want to do very quickly is just whip through some updated and recent case law and how since Montgomery the law has changed and adapted, and it is evolving. Very quickly after Nadine's case was a case called Webster, and this was important. It was Sebastian suffered catastrophic brain damage as a result of hypoxic ischemia. Now, her case was that his mother should have been given the choice about being induced and being fully told about the abnormalities shown on earlier in her pregnancy, so they could make a choice on the delivery or whether to come back. Now, what happened then was that the defendant argued that even if the scans had been done, they would have been reassuring and not given rise to the need for a heightened vigilance or advice about danger. So effectively, the scan had been abnormal, the mother had not been told about it, and if she had been told about it, she would not have waited to be induced. She'd had the baby there and then, and the baby obviously wouldn't have been damaged at that time. So that effectively won a court of appeal, but initially the Bolam test had been applied, and Montgomery was then reiterated at the Court of Appeal that actually informed consent and Montgomery should be applied. So then we go on to more recent cases where what happens when perhaps there is a risk of an abnormality of a baby. And this is obviously hugely difficult and absolutely imperative to have the informed consent from the mother. But this does not always sadly happen in cases that women are told about all the risks of abnormalities. I'm just going to go to some slides on. So in A versus East Kent hospitals, what was looked at was the material risk. And what the judge said, it was my experience of a number of cases where the mother is not informed of the risk of abnormality of their baby. In this case, the mother was not told about the risk of a chromosomal abnormality, which was 1 in 1,000. Now, in the judgment, it was considered to be theoretical, negligible, or background, and that the mother was not right not to have been told. Effectively, because the risk was so low, it was not right that the mother should be told about the risk. Now, that was because the mother would not have attached any risk and should have gone ahead, but regardless of that, I do think that actually the mother should be told about the risk. So where do we get to? We've gone through the breach of duty cases, but how does causation evolve in these cases? And this is where we're coming on to more recent law. Sorry, I'm going the wrong way. So what is causation? I don't know if everybody knows in the room. We've got some lawyers, but ultimately, causation is the but-for test in negligence. In other words, did the negligent failure to consent cause the actual damage? Even if you've breached your duty, haven't informed your patient properly about the consent procedure, what's the damage as a result of that? And in order to discuss that, the development of a case called Samco needs to be looked at, and I'm afraid it's very boring and really dull contract case, but it defines some issues that make it a little bit more easier to understand. So as I say, this was a contract case, and it was about defendant surveyors undervaluing a number of properties, and the claimant made loans on the security of those properties and suffered losses as a result. But for the undervaluation of those properties, the claimant would not have advanced the loans. Now, where does that take us in terms of these kind of cases? Well, I'll go to Lord Hoffman's quote, because that's a little bit more easy to understand. And he sort of pragmatically set it out up there, as you can see in his quote. And what he described to us is as a mountaineer about to undertake a difficult climb is concerned about the fitness of his knee. He goes to a doctor who negligently makes a superficial examination and pronounces the knee fit. The climber goes on the expedition, which he would not have undertaken if the doctor had told him the true state of his knee. And he suffers an injury which is an entirely foreseeable consequence of mountaineering, but has nothing to do with his knee. The doctor is not liable, therefore. The injury has not been caused by the doctor's bad advice, because it would have occurred even if the advice had been correct. So effectively, even the breach of duty does not relate to the injury. And that is effectively evolving the but-for test we have in medical negligence cases. Another case which we'll just elaborate on that is the Chester case. Now, the surgeon failed to warn the claimant of small risk that she might develop what's called a cauda equina syndrome. That's pressure on the spine and can cause paralysis as a result of spinal surgery. The claimant, had she been warned, would still have undergone the surgery, but at a later date. Now, the risk would have remained the same whenever the surgery was performed, and this went all the way up to the House of Lords, where it held that, but for the test was satisfied, the claim could not succeed on orderly causation principles because the risk was not created or affected by the failure to warn. However, the majority of the justices in that case said it was held that since the risk which materialised was in the scope of the duty to warn, it could be regarded as having been caused in law by the breach of duty. So in that case, the claimant won. But very recently, we have a new case that's in 2018. It's causing quite a stir in the legal world, and it's called Meadows. Meadows versus Khan. Now, this was a case that was about a mother, and she was concerned about her child having haemophilia. So she went to a doctor, and the doctor told her, "Don't worry, you haven't got the haemophilia gene," but incorrectly told her about that. That was a breach of duty. So shortly after the birth, the child was diagnosed with haemophilia. And it was accepted that, but for the negligent advice, the claimant would have undergone the testing during the pregnancy, which would have led to the termination, so that the mother would not have gone ahead with the pregnancy if she'd known about the haemophilia. However, the complicating factor was that later the child diagnosed with autism, which was unrelated to the condition. And the defendant admitted liability for the costs associated with the haemophilia because the defendant said, actually, that's the bit we're negligent for in the baby, but the other bits of the baby were not negligent, so we're not going to pay for the costs of that. And the difference was significant because it was a difference between £9 million and £1.4 million in terms of compensation. So it's fiercely fought. Now, in the High Court, it was ruled that the risk that materialised had everything to do with the continuation of the pregnancy. The autism arose out of this pregnancy, which would have been terminated but for the defendant's negligence. So effectively, the baby wouldn't have there, the autism wouldn't have been there, and the mother would have had the choice to terminate the pregnancy because of the haemophilia. And the judge said in the High Court, she said at first instance, to draw a distinction on the basis of considering the underlying reason why a mother would have wanted to terminate a pregnancy seems unattractive, arbitrary and unfair. In other words, to separate out the issues of which bit is negligent and not non-negligent injury. However, this went to the Court of Appeal, and the Court of Appeal disagreed. And the autism was described as a coincidental injury, and so outside the GP's scope of duty. The advice was sought in respect of one issue, namely whether the respondent was a carrier of the haemophilia gene. It did not extend beyond that. So it was central to the reasoning in Chester versus Ashford was the fact that the misfortune which befell the claimant was the very misfortune the defendant had a duty to warn against, a fundamental distinction with the facts of the case. Now, I'm not sure if this is being further appealed to the Supreme Court, as Nadine's case was, but I think I agree with the High Court judge, I don't know if others do, but whereby the pregnancy only existed in its combined state of disability because of the doctor's negligence. And it's very difficult to compare this case to a contrast case. I don't see how you can define the law in a contract case and then and describe it with a baby that has, is a human being. So either way, it's a sign of how the law is currently evolving on consent. But I think I need to wind up very quickly. Yes, I'm getting loads of flapping arms at me. What is still clear is that Montgomery and Nadine's brave journey and its impact is here to stay, I'm glad to say. And the medical professions should be acutely aware of providing their patients with informed consent, and particularly in a maternal context. All right, thank you very much.